illustrations up. One is of the transeptal fibers. It's on the microscope closer to Phyllis. The other one is a section of 3 adjacent anterior teeth. And if you look around on that slide, you can find both pre-attached and embedded cementicles. So look at that slide and look for those structures. You may find cementicles on the slides that you have in the slide box, particularly those ones that came from the perio department that do not have a label on them. So as we look at that tooth in situ, we've got a little contamination here underneath the cover glass, but we come down. There's the alveolar crest right there, so we'll increase the magnification. And it will help a little bit if you close down the iris diaphragm a bit and kind of give a little bit of, let me focus things here. A little bit of a diffraction on those Sharpie's fibers going into the bone. So right here, those would be the alveolar crest fibers. And as we come down, and we see that those Sharpie's fibers are pretty much perpendicular to the face of the alveolar bone, then you would have the horizontal fibers. So these will all be horizontal fibers in here. And then as you come down a bit further, you can see that that direction changes a little bit. So we have some oblique fibers. And coming down, there is a fold in the tissue here. But as you get down to the apex of the tooth, all of these would be those apical fibers. If we go back up, you'll see some vessels. The connective tissue immediately surrounding those vessels, or nerves that you might see in the PDL, that is the interstitial tissue. It's loose connective tissue, that's all that it is. And as we go up here a bit, on either side we can see osteoblasts and then cementoblasts and a little bit of interstitial tissue there. And there are those dental periosteal fibers that we'll talk about next week. Okay, well the only thing we're missing in here would be the transeptal fibers and also the epithelial rest. Now there is that cross section through the tooth, and you need to be a little bit careful when you look at this, because up here, that's the enamel space. This would be the attached gingiva in here, or the junctional epithelium. But in some of these, you'll have a profile in which you have some cementum, have a layer of osteoblasts, and right there is an epithelial rest. And you can see that on some of the other slides as well. Now, the slides that came from the perio department, I would certainly take a look at those. And there are a few interesting things you can find on here. There's a little bit of pathology. But as we look at this one, there's the enamel space, there's the junctional epithelium, and here we have some epithelial rests. Right there and right there. Number of vessels. The alveolar bone is a little bit irregular in shape, probably because there is some remodeling going on. In fact, we can see some osteoblasts right along that alveolar bone. And the fibers, well, we have nice oblique fibers right here. And this may not be the slide that I noticed a great deal of osteoblasts on, but we've got some cementoblasts right there. Let's take a look at the other side. Yeah, larger vessels. In fact, we can see an aperture there through the alveolar bone, transmitting some vessels and perhaps even a nerve. And another epithelial rest right there. Now you need to find a tooth with a bifurcated root to see the interradicular fibers. So let's go down in magnification a bit. And we can see one root going down in that direction, another root just barely over here. And so right here, since it's right in the crotch, those are the interradicular fibers. They kind of irradiate out in a number of different directions. So those would be on the sections of teeth that came from Dr. Caldwell. Okay, well, there's one more slide to take a look at here. I believe this is it. Yes, we've got, well, here we have free gingiva, enamel space, we have cementum, and as we come down along this slide, well, we can see a number of osteoclasts right there on the alveolar bone. So we have some remodeling going on. And as we come down here, there is a multinucleated cell. With a somewhat acidophilic cytoplasm. And so these cells right here would be what? Let's back off the magnification. There's cementum. There's dentin. Here we have a cell with a ruffled border sitting in Hauschipp's lacunae. So that cell is a what? Well, it looks like one, but since it's eroding dentin, it would be what? An odontoclast. It probably is an osteoclast, but since it's eroding cementum, it is an odontoclast. And if it were eroding the cementum, it'd be a cementoclast. In fact, we have probably, well, maybe one right there. Anyway, on those slides, you might see some remodeling going on, and also some bone or cementum formation as well. And also that's probably, well, there's a cementoclast right there, and some more osteoclasts in that same field. So make sure you take a look at those slides. Those will be the ones that I'll look for to show certainly the odontoclasts and cementoclasts for that next lab practical. Don't forget to look at the demonstrations. And you guys are all done with your quizzes for today, is that right? And then as a reward, you've got Dr. Harn right after that. Okay, so let's go ahead and get started.